Mihaela, why is it so important to be vaccinated against COVID-19?
It's very important to get vaccination, to get back to normality, to get back to life, to see an end, hopefully, to this pandemic, which is actually turning our lives around as medical doctors, but also as humans and part of the society in these days.
And one of the myths I've heard is that it affects fertility. That means women or also men who are vaccinated are not able to have children later.
The good thing about these vaccines at the moment is that are the most or the best well-studied vaccines of all times. So it's very important to know that at this point we know so well what is going to happen where we are injected with this vaccine that we can literally say this infertility is very less likely to happen. It was, as we know, there are over 4 billion people vaccinated at the moment. Many of them were already vaccinated in the trials. Mm-hmm. All these people were closely monitored. Blood samples were taken every single day. People were asked how they are doing. Full body checkups were done. And so far, at no point infertility was recorded as a side effect. Moreover, we have many female and many women and also men who were able to conceive since they were vaccinated. Okay. So we have quite strong evidence that this is not a side effect which of the vaccines.
And but what about now women who are breastfeeding, for example, and who hadn't been vaccinated, but now that they are breastfeeding, they want to be vaccinated? Does it have an effect, an influence on the child?
Definitely, it has a positive effect on the child. So basically, women who are breastfeeding are strongly encouraged to get vaccinated. I think as a young mother, the last thing that you want to be faced with to have a severe COVID-19 disease, to be then maybe isolated from your own child. The child will definitely not have any side effects from the vaccination. The only thing that could probably happen is that he will get immune himself, which is something very desirable and a very positive effect of the vaccination itself.
I've heard among Christians that getting vaccinated means that one is accepting the so-called mark of the beast.
If you take the vaccine, for example, you are not taking the marks of the beast. Everybody has to understand, first of all, there is authorities that are there. The authorities are not, they're not going to create something that can destroy the humanity.
What about now women who are breastfeeding, for example, and who hadn't been vaccinated, but now that they are breastfeeding, they want to be vaccinated? Does it have an effect, an influence on the child?
Definitely, it has a positive effect on the child. So basically, women who are breastfeeding are strongly encouraged to get vaccinated.
Mihaela, what would you say about that? If people have allergies, are there side effects when they are getting vaccinated?
It depends very well what kind of allergy. Pretty much the straightforward answer is they should get vaccinated, even more. That means they have probably an atopical terrain, that maybe their immune system it's a bit weakened depending on the allergy.
But what are conditions where you would not recommend the vaccine? Does it exist, any conditions?
There are two small, very particular cases where I would be more careful. This would be if the patient had a strong reaction to the first dose, as I mentioned earlier, then I would reconsider or really carefully be of administrating the second dose. And of course, we've heard, and there are some cases of myocarditis, perimyocarditis, which are very, very mild usually. But even if one occurs, then after the first dose, usually they appear after the second dose, and in young population, then I would reconsider if I would go for the second dose.
Okay.
These are pretty much the only two situations when I would be really careful and reconsider. I wouldn't say no by default. I would just reconsider as a medical doctor.
Okay.
Though.
If somebody is, for example, HIV positive, does the person have to inform the medical staff before being vaccinated? Are there any specific precautions that they will take?
HIV by default is definitely, especially if it's a controlled HIV infection, it's not at all a contraindication, and you don't have to inform the medical staff.
Okay.
You don't have, you can keep it secret, and it's not interfering at all with the vaccination process.
Okay.
It's also important to say that people living with HIV with a controlled infection, so we are talking about the ones who are taking their tablets every single day, they have the regular checkup, they will have the same immune response as the general population without any differences. And the same profile of adverse events, so not more than that.
Okay.
It's better that religious out there not putting confusion, but join hands and pray for the authorities, pray for the doctors, because we don't know the next pandemic that is coming to challenge the world.
If you have further questions about the COVID-19 vaccine, you can go to a pharmacy or to your doctor, or also visit the website of your canton. We are in digital days now. Or you can also call the info line, the national info line, which is 0800 88 6644. Thank you for watching us, and see you soon. Thank you, Michaela.
Thank you very much.
Thank you, Apostle Charles.
Thank you very much.